Hey guys, it's me again, and I am here with another diabetes video. I am a type 1 insulin-dependent diabetic. If you're just watching this for the very first time, I've been a diabetic for well over 20 years. I was diagnosed at the age of 7, so I've have other diabetes-related videos. If you want to check them out, I'll put the playlist down below. I wanted to talk about depression and diabetes because I don't think that's like something that's talked about often, which is a shame because it shows, and I have a resource up from diabetes.org, that people with diabetes have a greater risk of depression than people without diabetes. And it is true. I am not depressed, though I have had many days where I've had some sort of depression when it becomes regarding my diabetes. I mean, I can feel down a lot and sad about having diabetes. It doesn't necessarily make me depressed. However, it is very common for a diabetic to get depression because of the day-to-day lifestyle, you know, having to count calories and carbohydrates and insulin and all these numbers that are going through your head, testing your sugar, going to your doctors, going to the hospital, all these complications that we are faced with. It's absolutely normal to be depressed because of your diabetes. Now, there's a daily stress with managing your diabetes that is very overwhelming, and I mean, honestly, some days I let it get the best of me, but I recover from that because I know that I am a diabetic, but I don't let the diabetes control me. I do have general anxiety disorder, and that is related to my diabetes that I got later in life because of taking care of myself and letting things get to me. So, I mean, that goes hand in hand with mental health and diabetes. If you are someone who knows someone that is a diabetic and you see them down a lot, maybe loss of appetite, nervous, guilt, rebellion, you know, they don't want to do anything with their diabetes, they don't want to take their medicines, they don't want to test their sugar. You know, if you know somebody who's suffering with those kinds of things, maybe suicidal thoughts, always feeling sad, and you might want to reach out to them because diabetics are depressed. They can get depressed. I'm not saying every diabetic is depressed, but this disease that we live with is very challenging. And you can be in perfect health and perfect control or managing your health really well, and something can happen, like a monkey wrench gets thrown into your plan and ruins everything. Living with diabetes can be easy, but it's not easy, if that makes sense. I mean, you can make it easy, but even still, it can get to you. Now, there's a lot of issues with diabetics and depression, you know, especially the younger generation who gets it. Or not younger generation, if you're younger when you get it, I see a lot of people with diabetes who don't want to do anything to help themselves because they weren't a diabetic prior, and they don't listen, they don't take their medicine, they don't eat right, they cheat, they lie. You know, this is very common, but it is also something to take very seriously because these things can affect your health later down in the road, and that is something that you don't want to deal with. But if you know someone who is like that, definitely reach out for help. You know, ask them if they need help, or research and learn about the disease. Maybe there's something you can do to help this person, even if it's just being supportive. Now, if you're a diabetic and you do feel depressed and you feel like this disease is getting the best of you, like you can't do it anymore, it's just such a overwhelming feeling to take care of yourself. Just know that it's normal to feel that way, but you can get help. What I'm saying is, if you have depression and you're a diabetic, there are medicines out there, there are treatments, there are counselors, there are plenty of things out there that can help you feel better, because diabetes should not control your life. You should control your diabetes. It's what you want to do once you've acknowledged the depression. You need to seek help, because having diabetes, every little thing, including emotions, can affect your diabetes. So being depressed will affect your blood sugar. And you don't want that because it's like a vicious cycle. So reach out for help. Reach out to the diabetic. See if there's something you can do. Learn about the disease. And just be there and be supportive. And, you know, if you're diabetic and you're watching this and you feel depressed all the time, trust and believe that, you know, there is help out there. You are not alone. You know, there is a big diabetes community online. You can always talk to me or find other resources online or support groups on Facebook, because we all share the same pain as you do. So I just wanted to touch base on that yes, diabetes can come hand in hand with mental health issues like depression. If you have any questions, please comment down below, or if you are a diabetic and you feel like you have something you want to share with me, just comment down below. If you're friends and family of a diabetic, you know, comment down below, tell me. Maybe there's something I can help you guys with, even if it's just tips and suggestions. I am not a doctor, I'm not medically trained to give any sort of help, but being a diabetic, I do know how it feels and I can empathize. Please give this a like and share. I know if you know someone who's a diabetic, tell them to watch my videos and maybe we can connect. I thank you guys so very much for listening and watching, and I hope you learned a little bit of something about diabetes and depression. Until next time, take care.